Today we will be discussing the Rossetti Infant-Toddler Language Scale. The author of the Rossetti Infant-Toddler Language Scale is Dr. Louis Rossetti. The publisher is Linguasystems Incorporated. The address is 3100 4th Avenue, East Moline, Illinois, 61244. I have linked the website. The cost of the test kit and materials is $116. Moving into the description of the test. The target age is birth to 36 months old. The skill area is language assessment. The time needed varies as, per the subtest, it could last between 10 to 30 minutes.
This test assesses the pre-verbal and verbal aspects of communication and interaction in the young child. It assesses the following areas: interaction attachment, pragmatics, gesture, play, language comprehension, and language expression.
This test was designed to provide the clinician with a comprehensive, easy to administer, and relevant tool to assess the pre-verbal and verbal aspects of communication and interaction in the young child. Dr. Louis Rossetti said, "The examiner must have the freedom to determine in more than a single way if a child has mastered a behavior."
Prior to the assessment, complete the parent questionnaire to get information about the child's past and current skills. As the assessment begins, meet briefly with caregivers to discuss goals and expectations. Observe child and caregiver interaction to gather a language sample. Interact directly with the child to elicit the remaining items on the scale. Emerge child directly in free play to complete scoring scale.
We will now further discuss the 6 subtests within the Rossetti Infant-Toddler Language Scale: interaction attachment, pragmatics, gesture, play, language comprehension, and language expression.
The first subtest is interaction attachment. This consists of the cues and responses that reflect a reciprocal relationship between the caregiver and child. Pragmatics is the way the child uses language to communicate with and affect others. Gesture is the child's use of gestures to express thought and intent prior to the consistent use of spoken language.
The next subtest is play. This assesses the changes in the complexity of play behaviors because they usually accompany changes in language use and function in normally developing children. An example they provide in the handbook: for symbolic play to develop, the child must realize that a toy is only a representation or symbol of the real object. The next is language comprehension. This assesses the child's comprehension development progress from being heavily reliant to minimally reliant on non-linguistic cues. The next is language expression. This assesses the child's use of pre-verbal and verbal behaviors to communicate.
We will now discuss the examiner information. This test is designed for the use by any member of the infant-toddler assessment or intervention team. The examiner should have a thorough knowledge of the child's development in language, but they do not have to be a specialist in language assessment.
Regarding the testing environment, it may be administered in the home, diagnostic center, school, clinic, or the hospital setting. The surroundings must be comfortable to the child. The child's primary caregiver also should be present. The examiner's goal is to encourage the occurrence of specific behaviors rather than controlling how the behavior is obtained. We will now insert a video of us administering the comprehension and understanding portion of the parent questionnaire. For reference, this is what the parent questionnaire section looks like in the handbook.
Is your child easily confused when many things are taking place around him?
No, not really.
Okay. Do noise, bright lights, or lots of movement bother him?
No.
And can he distinguish your voice from others in a busy place?
Yeah.
How does your child respond when you give him directions?
Usually follows them.
Does it seem important for you to use gestures or point while you're giving him directions?
I do, but I don't think he needs it.
Can he follow 2 directions in a row?
Yeah, mostly.
And do you need to repeat directions when you're giving them to him?
Sometimes, but not really.
Okay, so how does your child respond to simple questions?
He can usually answer them pretty well.
Is he able to answer questions that require a yes or no response?
Yeah.
Okay. And does your child's answers to these questions make sense most of the time?
Usually, yeah.
Okay. Right. And then how would you describe your child's intelligence and thinking skills?
It's pretty above average.
Can you describe something that he learned to do pretty easily?
He learned to potty train pretty quickly.
Potty train. Okay, and then what's something that was a little more difficult for him to learn or still learning?
He has trouble sitting still all the times.
Okay.
When scoring the test, if the behavior in question is noted in one of the 3 following ways, items are considered passed. If a child is not demonstrating a particular behavior, the box will remain unchecked. Observe, or O, means the examiner directly observes the child spontaneously demonstrating a behavior. Elicit, or E, means the examiner or caregiver elicits a desired behavior from the child directly. Report, or R, means when a behavior is not observed or elicited during the assessment, the examiner asks the caregiver if the child has mastered the behavior and if the behavior is present rarely or frequently.
Now we will discuss how to find the basal and ceiling scores. Determining the basal begins with interaction attachment 6 months below the child's chronological age. The testing progresses backward until all items are mastered. Determining the ceiling includes testing progressing forward until the child fails all items. Repeat procedure for each developmental area.
The picture shown is an example of the play subtest being scored. Each question was marked Report.
The assessment strengths are being comprehensive, easy to administer, and being relevant. This assessment was designed to be a comprehensive, easy to administer, and relevant tool to assess the preverbal and verbal aspects of communication and interaction in the young child.
On the other hand, these are some weaknesses of the assessment. This is a criterion reference assessment instead of being a norm referenced instrument. This test also does not give standard scores, age references, or percentile ranks.